Thank you for a very nice and comic introduction. I think Dr. Nyongesa deserves another round of applause. She did a good job, and I actually feel that she said 90% of what I had to say. So, just like they say that repetition is the mother of science, I know the saying in French. I don't know if it translates the same thing in English, but I've just... Comment? Oh, la répétition est la mère de la science. Yeah? Good. So just repeat what she said, but in my own way, okay? And I'll try to take as less time as possible so that we have time to discuss. So I thought I would, when I was given this topic, I was thinking that should I just say about how I cope with all the nights that I spend in the hospitals, and say about how I cope with life outside of the hospital and the amount of effort and energy that I put into staying fit, both mentally and physically. Or should I be more general, because this applies to a general audience, and share what I feel is the most important aspects of what we should focus on to live longer and to live juicier life. So I chose the second, and I'll talk about why cardiovascular health matters, and I'll use hypertension because I think it's the most important cardiovascular risk factor. And then I'll talk about the science behind what pressure does to our cardiovascular system and how we can cope with it. So, what is the most important asset that you guys bring to your boardrooms? Any idea? Well, of course, there are ideas, but like what? Yourself. But that's not enough. Is it your title? Is it your technical expertise? Is that enough? How about your network? All the people that you've met before that help connect the dots of your work and make it, make the numbers go higher and higher all the time. So I believe it's your capacity to think clearly and to make sound decisions and to regulate your emotions and remain present, particularly when the stakes are high. And that you cannot do without a good health. As you know, the brain takes up about 20% of blood. Am I audible?
No, you're audible, but this thing, just put it off.
Yeah, so the brain takes up 20% of blood that it gets from the heart, and that's through the cardiovascular system. If you don't have a proper cardiovascular system, then it's tough. Yet we know that in high-performance environments, like where you guys work on a day-to-day basis, health is often treated as something we attend to after either the meeting or transaction, or after the children, or sometimes the husbands are settled, and even after the organization has sort of stabilized. And that's probably just what Dr. Nyongesa said. So your health should really not be considered as a personal medical matter, but rather as a leadership competency and governance and organizational resilience issue. But why does it matter? Why does cardiovascular health matters? It's simply because it's so commonly affecting people. It's taking lives from us. It's number one killer, and particularly in the low and middle income countries. 3/4 of people die from cardiovascular diseases. And you can imagine that's not a very distant problem. We know a friend or a colleague or a relative who died of stroke, heart attack, heart failure, hypertensive heart disease, chronic kidney disease, dementia, and all that. And that's just simply related to cardiovascular disease. These are the different types of cardiovascular disease, and I really won't spend too much time on that because you all know them. You just need, and you know how to prevent them, but you just need to apply that into your day-to-day life, because about 70% of cardiovascular diseases worldwide is caused by modifiable risk factors. And I need to underline the word modifiable because that's the key. That's why the key is. We need to be able to state that if we avoid a certain things, then you're likely to avoid falling into the group of people who suffer or will suffer cardiovascular disease. And I've just put a list of all the sort of, the known cardiovascular disease risk factors. And these include unhealthy diets, physical inactivity, alcohol, smoking, all those that have been mentioned. What we know that is not modifiable is genetic variability, your ethnicity, gender, and your age. Unfortunately, you cannot change those. But all the other things like sleep disorders, anxiety, poverty is part of them, air pollution, and psychological stress of whatever it is, are modifiable risk factors for cardiovascular diseases. If I put it in a scale worldwide of global attributable death and cardiovascular risk factors, you see clearly, not even cardiovascular, all the risk factors for dying, you see that hypertension comes number one, both in men and in women. And that's why I wanted to focus a bit more on high blood pressure. As you know, it's a global health crisis. It's very bad. I don't know if you know this, but the incidence of hypertension is very high. 1 in 3 people who are 40 years and above are hypertensive. So if you take us here, I don't know how many we are, 100 or less, 30% of us are hypertensive. Do we know it? Maybe, maybe not. Do we take medications? Do we do something about it? Maybe, maybe not. Because also, the global control rates are dismal. Less than 40% of treated hypertensive patients are controlled, which means that 60% and above are not controlled. And what does that is that it remains a leading preventable cause for heart attack, stroke, chronic kidney disease, and dementia worldwide. In Kenya, just so you don't think that this is a far-fetched problem, 1 in 4 adults, and this is not just one single study, is hypertensive, and the number of people who are controlled on medications is less than 15%. So many people who appear productive, successful, and completely well may be living with high blood pressure without knowing it. And that's why it's called a silent killer, and that's why performance is not proof of good health. Why are you guys even more exposed? Why are you even more exposed? You can read there. So there are compounding risk factors for leaders and for people who work in high-stakes environment to be exposed because you're chronically stressed. You work long hours with limited physical activity, and you frequently travel. You have irregular amount of eating, and sometimes you don't eat very well. And you have disrupted sleep, and sometimes you skip routine checkups. There was a question about how many of you guys have done checkup in the last 1 year, and I thought I had just a couple of voices, not all of you, which is a problem. And it's a real problem because if you don't know, you don't know, so you can't act upon anything, right? I probably won't bore you with all these guideline manenos, but I wanted to mention that when you go to the clinic and they tell you that your blood pressure is 138/92, is that normal? It's not normal, right? You know that. Perfect. Then we can skip maybe several slides here. Yeah, so normal, I'll say it. Normal is less than 120/80. That's normal blood pressure. And I'll show you why. I will show you some evidence to that. If you have a blood pressure of 127/82, that's not normal. It's not a diagnosis of hypertension, but it's not normal. It's elevated blood pressure. And I will again show you why it's very, very important. Now, if you have 140 and above, over 90 and above, you need to start medication. You have stage 2 hypertension. If you are 130/80 and above, you have stage 1 hypertension. You don't necessarily need to start on medicines, but there are things that you can do to prevent further progression, but also to make sure the blood pressure comes back to target, which is less than 120/80. So where do these blood pressure targets come from? They come from research. And I just selected this one to, again, I don't want to talk too much science, but this is easy to understand. So what these guys did, they took a cohort of patients, about 10,000 people with blood pressure problems. They told one group to take medications to a blood pressure target of 120/80, okay? And they took another group, about 4,000 something individuals, they told them, take your medications, measure your blood pressure, or we'll measure it for you, blood pressure target 140/90 and less, okay? And this is what this graph shows. These are the people, 140/90, 120/80, over about 5 years. And then they looked at these people, about 10,000 people, over time. And they found out that the people that took blood pressure to a target of 120/80, they actually had about 25% lower risk of developing any of this. Myocardial infarction, which is heart attack, stroke, acute decompensation of heart failure, which is heart muscle disease, either due to hypertension or something else, and cardiovascular death, dying from any type of cardiovascular disease during 5 years. It's not even like a long observation period. You can see if you can reduce the risk by 25%, that's big, right? We're talking about 10,000 people, but take it individually, it makes very much sense, and it's something that you can definitely work for. So when do we propose people to start treatment? If you have a blood pressure 140/90, you definitely need to start treatment. If you have 120/70 or less, you don't need to start treatment. But if you have 120 to 139/70 to 89 millimeter of mercury, it really depends. Now, it depends on what? It depends on the other things that you've got that are going on. If you're chronically stressed, if you have diabetes, if you have cholesterol problems, you have a strong risk factor, a strong family history of stroke or heart attack, then it would be better for you to start on the medicine, because the blood pressure management in that context derives pretty much strong benefits in terms of reducing your cardiovascular disease profile by more than 20-25% if you're followed. So how do we lower blood pressure? Of course, you know this. There are 3 things. 1 is lifestyle, 2 is medications, and 3 is some new technology called renal denervation therapy, and I probably won't bore you too much into this, but it's something that I can explore maybe in the discussion. So lifestyle, and this is very important. I wanted to spend maybe 2-3 minutes talking about lifestyle for hypertension. You've all heard about this. It's mostly to reduce salt, to increase potassium intake, increase physical activity, and optimize your sleep and your weight, and reduce alcohol intake maybe to 0, and not start to smoke. Again, smoking, you know, there are several types of smoking, yeah? We know active smoking, but what I feel in our contexts, what I feel happens mostly is actually passive smoking. You go sit in a bar with people who are smoking, you're actually smoking. If your husband smokes every night in the bedroom, you're a smoker. You're just a passive one. So now, in terms of lifestyle measures, this is an interesting study, and I chose to present this because you guys cook for us. I mean, we do cook too, but this is very important because I know you guys are big bosses in your institutions, and hopefully you can help drive this industry, what we bring into the country, and maybe choose healthier choices than what we have now. So this is an interesting study that was published not so long ago, about 4 years ago, in a rural area in China. They took about 20,000 people and they subjected them to, they divide them in two groups. And they took one group, they gave them 100% sodium chloride, which is the salt that we eat, yeah, in our homes. And they took another group, they gave them 75% sodium chloride and 25% potassium chloride. And they followed them over time. Mean follow-up period was 4.7 years. And they looked at all these individuals, and you know what they found? You can read. They found that there was a significant less number of strokes, major cardiovascular events, death from any cause happening in the people that took less sodium chloride. Basically, they took the combination of sodium and potassium chloride instead of 100% sodium chloride. What that tells us is reducing salt alone can actually save lives. Yes. Good. But the other thing is, say we've started somebody on blood pressure medicines, and this is what I do, I'll tell you from experience. If I start 100 people on antihypertensive medications, within 1 year, only 50% of them will be taking their medicines. Now, this I don't know why, but those are facts. And these are facts that I need to tell you because you guys are not my patients, but you lead. So leading means you serve examples and you help people understand certain things in life, and you serve as examples, most important thing. So the only thing that I think when I see this is that people don't necessarily understand how serious the condition is. And maybe we need to start from there. And I can't do it alone with my colleagues. So you're going to help. I hope you will. All right. Because there is obviously what we just feel that we've done a good job by prescribing an antihypertensive medicine. But there's also what the patient feels that, oh, my Lord, all this? Anyway, let's go back to the high performance paradox. So you guys are always praised for qualities such as endurance, availability, composure, decisiveness, and the ability to do so many things, particularly women, they're labeled as multitaskers. These are very good qualities, right? But they can also hide a very serious risk. The leader who never switches off is called committed. The one who sleeps 4 hours is called very disciplined. Does everything by morning. The one who walks through illness is called dependable, and the one who does not ask for help is called strong. Eventually, unhealthy behavior can be mistaken for leadership excellence. You can actually be called a very, very strong person or personality while you taking the hit without knowing. So the paradox is that the habits that produce short-term visibility can undermine a long-term leadership capacity because you can't do it. You're going to burn out at some point. And that's why it makes sense to just focus on the most important thing, learn to delegate and make sure that your cardiovascular health takes priority, because it's not even, it doesn't just affect you, it affects the institution, it affects your family, it affects a succession plan, it affects the people that have confidence in you that you can actually lead the organization for a long, long period of time, and it affects your decision-making capability. And so health actually belongs on the leadership risk agenda, and it's good that you've invited us, I and Dr. Nyongesa, to talk to you about this. So in terms of the science behind the pressure and stress and how the heart gets affected, is that the job strain, and particularly if you work for long hours, is linked with 10 to 40% increase in risk of heart diseases and stroke. And in women particularly, there's a 40% increase in heart diseases in the people that work high stressful jobs compared to the people that work less stressfully. So what does the pressure do to the cardiovascular system? Pressure is actually good, you know. Short periods of stress, they do sharpen attention. They help us remain sharp and quick and be able to think thoroughly. The body releases certain hormones, particularly adrenaline and noradrenaline and cortisol, that make the heartbeat a bit faster, the blood pressure would go high a little bit, the energy becomes available immediately so that you can use it to think. The issue is when this becomes your normal operating system, all these things happen. Because all these hormones that are constantly released, I'm talking about cortisol, noradrenaline, and epinephrine, when they're released, they don't just affect the heart rate and the blood pressure, they also affect the capacity of the body to make insulin and the capacity of the body to use insulin. We call it insulin resistance, and that's where diabetes develops from. They affect your body to be able to use fat very well and to get rid of abnormal fats, and that's where obesity comes in from. They also causes inflammation, and they also cause what we call endothelial dysfunction, and it also affects your coagulation cascade. They affect a number of organs at the same time, and it's not good. The result is definitely not good. And so, and it's not just the hormones. It's also about the fact that there are behavioral pathways that are affected in terms of sleep disorders, emotional control, emotional eating, for instance, reduced exercise capacity, and particularly delayed care seeking, because you continue to feel, okay, I've felt like this for several months. I'm fine. It's just that I'm getting old, but otherwise I'm okay, you know? But it's bad. And so, again, acute stress is adaptive, is good, but chronic and relenting stress without recovery is the danger. So what are the mitigation strategies? Let's go back to blood pressure, and I'll ask you the same question that Dr. Nyongesa asked. Who knows what their blood pressure is today? Today. Oh, very good. At least you have about 3% in the room. What was your last blood pressure check? For those who did not respond, what was your blood pressure check? Was it last week, last month? Yeah. And when was your last comprehensive checkup? This you don't have to answer me. Just answer yourself. So I think we have to agree that the first leadership exercise you can do to yourself is simple, is to know your numbers. And you have to understand and periodically check your blood pressure, your blood glucose, your cholesterol levels, your weight, your physical activity pattern, your sleep quality, your smoking exposure, your family history. And blood pressure particularly, like I said, it deserves particular attention because it can be elevated for years without you knowing. And again, do not rely only on how you feel, because some of these things, they don't give you symptoms. Cholesterol will never give you symptoms until cholesterol buildup have happened in the cells and then tissues and then organs. Our cells divide constantly. When we are resting, the cells divide, but they also do what they call repair mechanisms. All the reparation of bad divisions that have happened all the day, they're repaired during the night. There are hormones and systems that are responsible within our body to do that. If you don't sleep enough, that is skipped. There are actually some evidence that this is a link between cancer, between dementia, and poor sleep over time. So 7 hours to 9 of sleep every night, please, from today. All right? 7 to 9 from today. Don't go partying. And if you don't smoke, obviously don't start. And of course, the other health factors that are important are blood pressure. We've talked a lot about it, cholesterol, weight management, and blood sugar. So just to finish off, there are 3 commitments that you need to give to yourself. One is a personal commitment, choose any of this, a leadership commitment, and a governance commitment. With that, I thank you very much for inviting me again. Thank you.
The leader who can't sustain their own heart can't sustain their organization. Have you seen that? Yeah? So let's start looking at how to sustain our hearts. I think I feel challenged by this. I don't know, is anyone feeling that? Yeah. Like, hey.
You feel mad?
Yeah.
Yeah, okay.
Something like, I need to do something about it, isn't it? Okay. So, any questions? Woo. Yeah.
My name is Catherine Nyaga, Governance, Risk Management and Audit Professional. I help organizations to increase the chances of their results through managing those aspects. So that's that's my elevator speech here. Thank you. So thank you so much, Daktari. I have 2 questions. I think you've had the mama in the room when you talked of 7 to 9 hours. I think majority of us struggle with sleep. So the first question is, what's your view on sleeping pills? Because sometimes we just have to go for them to add those hours. Number 2, exercise. You've talked about physical activity. With our kind of lifestyles, especially those who work in offices, you're sitting the whole day. So in the morning, maybe you'll wake up, do gym, but the rest of the day you're sitting. And there's this narrative that sometimes you need to keep moving after every hour. So what's your comment on like the early morning activity, little movement during the day versus every hour you stand for the 10 minutes, walk around and yeah, thank you.
Thank you. Thank you very much. I think those are fabulous questions. Number 1 is the sleep. Sleep and the pills that we use to sleep, or that some people use. In my opinion, sleep is more about hygiene. This is a hygiene of the sleep. The way, the things that you do to make sure that you're going to sleep very well. It's not a one day, one night thing. If you're chronically stressed, if you have things in your mind, you won't sleep very well. If you take several cups of coffee and strong tea at night or in the evening before you go to bed, you won't sleep very well. If you watch TV or phones, as a matter of fact, then you won't sleep very well, because sleep does not like light, right? So there are hygienic things that you need to do to your room, to your environment, to the people that you live with, be it music in a room or TV in a room, all those things. You have to work on those first before you consider pills. And I agree that sometimes as we age, sleep becomes much, much less compared to younger people. And that's also because of the lifestyles and what stresses us, all the stresses that we've kind of mentioned about. So when you can't get enough, then sleeping pills can be considered, provided you've done everything else. There are different types, and some of them are not good for long-term use because they make you dependent on them. And they also can make you tolerant to them, which means a dose that you're taking today is not going to be the same dose you're going to be taking 6 months later, if that makes sense. So you have to not buy them out of the chemist. You should probably get your sleep pattern checked by a professional and adapt to that. The pill that I can recommend if you need to is the natural pill called melatonin. Melatonin is the same hormone that our brain secretes when we're about to sleep. If in a room, you switch off the light, you're ready to go, your body, your brain secretes a lot of melatonin. That's the one that makes you fall asleep. So you can try that, and it's pretty much cardiovascular safe in any context if you want to increase your sleep pattern. But I wouldn't even recommend that if you haven't done A, B, C, D to make your sleep better. Now, second question is exercise. Exercise is important. It doesn't matter when you do it. Morning, evening, daytime, it doesn't matter. What matters the most is actually consistency of doing it. Because if you do it in the morning and you wake up and you feel like you're struggling to wake up every morning to do the exercise, then you know that you won't sustain it. What you need to do is to choose a time of the day that you feel that you're going to be consistent about, and you do it and you make it part of your routine. Most people say, oh, I'm busy. I have a lot of work. I can't find time to exercise. You know what I tell them when they come to the clinic and say that? I say, do you brush your teeth in the morning? Why do you do that? Huh? Good. It's a routine. So you have to make it a routine for it to work. Choose a routine, include the exercise in your routine. 10 minutes, 10. 15 minutes per day is better than 0. You agree? So make it in your routine. Find a routine that works for you and apply it. It doesn't matter what type. Walking, jogging, cycling, gym. It doesn't matter. I mean, it depends on why you're doing it, right? If you're doing it to lose weight, just know that it won't work. It doesn't work that way. You're doing it for cardiovascular fitness and for you to get the benefits, including dementia prevention and insulin sensitivity, all the biological factors that we've mentioned. But for weight loss, it's not just exercise, it's exercise and many other things that we can go into. Thank you.
Good afternoon, ladies and gentlemen in the room. Thank you for a wonderful session. My question is related to the factors that you've spoken to when it comes to hypertension. I want to talk to one factor, stress. I sometimes get maybe people who go to see their doctor. So maybe 1 week before, their blood pressure was okay. 2 weeks later, the blood pressure is elevated. And most of the people explain it as stress. And I would want to understand what is that relationship that 1 week you can be okay, your blood pressure is good. The next week, it is elevated, or almost going to a situation where you're being told you need to take medicine. So explain, is it stress? Is it diet? What is that explanation? That's my question. Thank you.
Actually, my question is very simple and is really a question. My name is Esther Nyongo. I've just left formal employment, so I'm in the transition period, so probably I have time to sleep. So my question is, how often should you take your blood pressure, especially now that you can even at home? What would you advise of how many times a week or a month?
Very good. Those are very good questions again. So I think the easier one is, how many times should you check your blood pressure? You can check as many times as you want. What is recommended though, if you're younger than 40 years and you're not known hypertensive, you can check every 1 year. It's okay. But if you're more than 40 years and you don't have hypertension, about 3 to 6 months is good. If you're known hypertension, you should check more often, maybe once a week or even more. Now, in terms of risk factors, or rather the correlation between stress and hypertension, I mentioned that. When you're stressed, the body releases hormones that we call stress hormones. Yeah? Remember the flight or fight hormones? They're called cortisol or noradrenaline or adrenaline. You've had all of them. They're usually released mostly by these small glands that are on top of the kidney. They're called adrenal glands. But they're released in response to what the body, the brain, commands them to do, the adrenal glands. When they're released, they would stay in the system for just a couple of hours, and then they will go down to a normal level. Now, if you're chronically stressed, if you're constantly stressed, these hormones will remain high. See, just to make it more understandable, I hope, when you go to exercise, or when you're excited about something, or even when you laugh, if I measured your blood pressure in the moment, your blood pressure will be high. But that's not abnormal. That's okay, because blood pressure is not a static thing. It has variabilities depending on the situations and depending on hormonal secretions, the same hormones that I mentioned. But if you always have high levels of norepinephrine or noradrenaline, adrenaline, cortisol, then your blood pressure and your heart rate will be high. And like I said, they don't just affect the blood pressure, these hormones, they affect many other functions, including the way you use insulin, the way you use fat distribution, the way the inflammation process goes in your body, the way coagulation cascade goes in your body, and so on and so forth. They also disrupt your sleep and many other things. If you come to the clinic and we tell you that your blood pressure is high, it doesn't necessarily mean that you're hypertensive. It never means that. We do confirm hypertension based on a number of things, and we call them diagnostic criteria for hypertension. What we focus on is actually to do a home or an out-of-office blood pressure measurement. Sometimes we do recommend that you buy a blood pressure machine, you take it at home and you measure yourself a couple times. Or sometimes we'll give you a small device we call ambulatory blood pressure monitor. You take it at home, it measures your blood pressure every 15 to 30 minutes for 24 hours. Then you bring the device to us, we analyze those blood pressure measurements, and we tell you. If over 24 hours, your blood pressure has been high all the time, this is a problem. because it shouldn't be. Because you can't be stressed even when you're asleep. Does it make sense? Yeah. And that machine takes your blood pressure even when you're asleep. So that means that something is wrong. So we can't attribute your high blood pressure to stress, but stress contributes a lot to it, if that makes sense. So in summary, and I know this is a long answer, stress contributes to hypertension, but stress is almost never the only thing that we look at, because acute stress is normal, chronic stress is bad. Make sense? Yes. Thank you.
All right, Dr. I have the mic. Good afternoon.
Good afternoon.
My name is Irene Kimashia, leading strategy, communication, and stakeholder management at the Institute of Human Resource Management. Dr. Nyongesa spoke to it earlier. Kindly speak to hypertension and pregnancy, preeclampsia, HELP syndrome, and does it go away, or what are the chances of it going away postpartum, and what can one do around that? Thank you.
That's a fabulous question to the gynecologist in the room. Where is she? So, first of all, before I talk about the pathophysiology of preeclampsia or hypertension during pregnancy, let me mention that some of the traditional risk factors that I mentioned of cardiovascular diseases, they don't include things like preeclampsia or pregnancy-related dysglycemia, sugar problems, and blood pressure problems during pregnancy, which end up becoming notorious to cause chronic problems. So if you've ever had preeclampsia or hypertension or sugar problems during pregnancy, just know that your risk profile for any type of cardiovascular disease is not zero. It's not zero. You're not working from a baseline. You're working from somewhere. Okay? Yeah. Now, preeclampsia is not a vascular disease or cardiovascular disease. It's a disease of the placenta. The initial insult happens in the placenta. The placenta cannot get well perfused for whatever reason, and it gets sick and releases some toxins that are bad for the blood, vascular system, and for some other organs such as the kidney and the liver, and when it becomes worse, the brain. Because some people present now with what we call eclampsia, which is now a brain syndromic presentation where you have seizures as a result of those toxins and high blood pressure. The treatment for it is standard. Probably won't go too much into details, but the treatment should not stop when you deliver. The treatment has to continue in terms of monitoring your blood pressure, monitoring your kidney function, because most of the time the kidney function is affected. It releases some proteins that go through the urine that shouldn't be. And most importantly, if you're young and you plan to deliver or to get pregnant again, then the risk of getting the same problem, or even worse, is extremely high. It's more than 50%. So if you know somebody who's got preeclampsia, you have to advise them accordingly. Sometimes when it reaches a certain point, we tell them it's probably not good to fall pregnant again, but the decision is yours, if that makes sense. Postpartum up to 6 weeks is a very high risk. Some people may not get preeclampsia before they deliver. They develop it after they deliver. It's still part of the process. It's still part of the disease process, unfortunately. Yeah, it happens.
Hi, Dr. My name is Winnie. I'm not asking a question, but I wanted to speak about something that I think and believe has helped a lot of people on the issue of sleep. Now, ladies, the doctor said there are some of these things that you need to do. But there's one thing that we don't do. We don't get intentional about things. Because if you have to minus some of these things in your calendar for you to sleep early, how many people have a calendar of events? Your priorities are always planned. Work, meetings, and all those things. But when you get home, you don't know when you're going to sleep. You don't have a certain time that you're going to sleep. Why is that so? Yeah, so you will sleep whatever time. Either it will be determined by a friend who called and you spoke for 2 hours, it disrupted your sleep. You decided your child and all these things. But then, again, cleanly, you call it cleanliness, but you need to be clean. If you have clean eating, you need to have a clean sleep. And this sorts a lot. When it was said that you're supposed to sleep 8 hours a night, my desk were like, where will you get that time? It is because you're not intentional about it. If in your house you need to create rules, you need to have, if it is by 8, all phones should be in the sitting room. Everybody should go and sleep. But we think that because we have these phones, everybody is going to die. Nobody is going to die about it. By the way, if you die tomorrow, that advertisement is going to be out before you're even buried. So you're not that important the way you think. If you're important to yourself. So we need to be very intentional about our sleep. Personally, I have 2 phones, not because I'm a Luo, but because, yes, I'm sure. Because, you see this phone, it rings like, it's like a customer service. Because once you get into these spaces, you interact a lot. If you go home with this phone, even your own children will start questioning you. You know why? Because it will be ringing, you'll be picking calls, you'll be responding to WhatsApp and all that. Personally, what I've done that has helped me, I have 2 phones. One is for very strict people who I know the emergencies must be my problem. And I have conditioned them that, please, past 9, do not call me, if it is not an emergency. But this other one, I'll put it aside. I don't matter whatever it is, I'll answer it tomorrow. If you do that, you will have your time, you'll have a routine that you're doing. And take it very seriously, because some of those medications that we are told to take end up being poison. Isn't it, Daktari?
No.
Yes, they will end up being poison to you because you accustom yourself to taking medication. Daktari will explain on that, I know. But then, like he said, there are things you can do. There are things you can actually do for yourself to make it better for yourself. Ladies and gentlemen, jipendeni. The day, as I finished, the day I lost my mom, it was on 31st of December at 1:18 a.m. 1:18 a.m. people were celebrating the New Year. That morning, life was going on as normal. People were wishing each other a New Year and people are celebrating. Life does not stop by what you do as a leader in wherever you are. You need to create time to sleep.
Thank you. I think that's a strong message. Thank you very much.
I may inject. Did you feel that injection? Painful, isn't it? But true. Last question, please. We are closing. Okay, there are no questions. I said last question, and then many hands went up. Huh? At Wendy, we...
Good afternoon, ladies and gentlemen. So my name is Rebecca Tiba. I'm from Madison Investment Managers. And my question, I know you skipped it when you were explaining about the interventions. I happen to have a lot of experience with high blood pressure because I'm one sufferer and there's a history. There's a family history, that is. And I remember my dad, because he has that coronary heart disease, there was an intervention that the doctor recommended. And what I came to find out is that one of the symptoms of high blood pressure, the silent disease, we can say it's silent, but it has symptoms. Like you've said, the blood pressures being elevated, but most people don't check, especially men or even us ladies, especially in leadership. But one of the issues was, one of those symptoms was veins, varicose veins. And that intervention, it has something to do with cutting a vein or something. I don't know, something around the legs. Maybe if you can just explain, because I'll feel like you've not completely satisfied some of us who are asking that question. If you can just explain in 5 minutes what that third intervention is. Yeah, and how varicose veins, and many of us ladies have them, can be a quick sign of high blood pressure.
Okay. Varicose veins is a disease in its own. It's a disease of venous circulation. Hypertension is not necessarily a risk factor for it, but they can coexist for the same reason that what weakens the veins can also weaken the arterial system, because hypertension is a disease of the arteries, the small arteries. In fact, they are called capillaries, that don't dilate very well. They constrict instead. Varicose veins instead is a disease whereby the veins are weak, that they cannot pull blood back into the heart. And sometimes it's a problem in the valves. The veins contain small valves that help to push blood up. Sometimes it's just weakness in the wall of the veins themselves. So there are two different syndromes. They can happen in one individual at the same time, but one is not necessarily a risk factor of the other. That's how I would answer it. And like you said, if your dad had treatment, an interventional treatment for varicose veins, indeed it's okay. It's one of the treatment modalities to do an interventional procedure to sort of improve flow into the vein, or to cut the external veins, to block their communication so that blood can find other channels to go back into the heart. But there are also medications, and there are also lifestyle measures that we use to treat varicose veins. So I guess that's how I would answer it. Of course, there's a bit more to that. Thank you.
Great. Good evening, ladies, and thank you, Dr. for that insightful presentation. Ilka Gashanja, I take care of legal and compliance at Absa Bank. Quick question, maybe you could give us some insight on low blood pressure. What causes that, and when should you be concerned? Because there are some people who don't have it, but also suffer from low blood pressure.
If I understand well, the question is, what is low blood pressure, and
when should you be concerned? Because at times
when should somebody be concerned about it?
Yes.
I'll tell you, as a cardiologist, I would say that if your blood pressure is 90, 85, 100 systolic, over whatever it is, and you don't have symptoms, then it's not a disease. It's fine. It's actually better. I would wish that my blood pressure was 90 over 60. That's okay. As long as you don't have symptoms, you don't feel tired, or you don't feel dizzy at times, or you don't feel like you're fainting. Now, there are situations that can lead to low blood pressure. Now, in that situation, low blood pressure would not be called a disease. It's actually not a disease. It would be called a symptom of something. Those situations include poor hydration, like if you're not hydrated enough, or infections, if you have something called sepsis, bacterial infection in the bloodstream that leads to low blood pressure. That is a serious condition. You need to go to the hospital, you need to be sorted. You will probably have other symptoms over and beyond low blood pressure. You have fever and all that. There are also some other conditions. For instance, if your heart is weak, or if you have a valve issue, if one of the valves is leaking, you may develop low blood pressure. Low blood pressure would not be a disease in that context. It will be a symptom. The short answer, that was the long answer, the short answer will be, if you find yourself having low blood pressure, The initial thing is to get screened, just checked, check your heart, check if you're well hydrated all the time and all that. If they tell you that everything is fine and you don't have symptoms, there's no reason to worry, because low blood pressure is almost never a disease. Thank you.